Welcome to the NFP Podcast, where we explore the empowering world of natural family planning. I'm Amy Smith. Join me and my co-host Emily Appledorn each week. Together, we're here to dive deep into the science, the stories, and the spirituality behind NFP. Every week, we push back against the free love culture and advocate for a culture of responsible love, where intentionality and respect are at the forefront of family planning. Join us as we discuss everything from the practicalities of charting and fertility awareness to the profound impact NFP can have on relationships and communities. Whether you're new to NFP or a seasoned pro, our podcast is your go-to resource for honest conversations, expert insights, and real-life experiences. So grab a friend, settle in, and get ready to be inspired. This is the NFP Podcast.
All right, guys, welcome back to the podcast. Today, Emily is not with us, but we are really excited. I'm really excited to have on with us Shannon Leach. She is a nurse practitioner. So welcome to the podcast, Shannon.
Thank you. I'm so happy to be here.
So I found Shannon through the Facts About Fertility blog, which our listeners are well familiar with because we've had Marguerite on. In addition, we've had on other people who have had their stories featured in their blog. So why don't we just jump in, Shannon, and you can start sharing. I'll link for everyone to the blog post in the show notes. But why don't we just jump in and kind of share? I'd love to hear how you got to nurse practitioner, but also mainly kind of how you got to the world of fertility awareness. Was that something you were always familiar with your own body? Are you a user of it, just using it in your medical practice, all those things? So I don't know, wherever you want to begin.
Sure. So ironically, it was only about a year ago that I was introduced into the world of fertility awareness-based methods. I was interviewing or in the process of trying to get a job in a women's health clinic, which was formerly like a pregnancy crisis center, and was asked to jump on this webinar where Katie Vidmar, who works very closely with pregnancy resource clinics, mentioned Facts for Fertility. And I jumped on their website and started doing their continuing education and was like, oh my gosh, like at the time I was not quite 40. And I was like, how am I almost 40 years old? I've never heard of this. I was never taught it in nurse practitioner school. And like, as a woman and like going through education in high school, I was like, we were never taught about any of this. And it was just mind blowing to me. And it was particularly eye-opening because I actually went through 3 rounds of IVF to become a mom, to have my 5 children. And it was sort of this epiphany of like, if things had been told to me differently, like I probably could have restored my root cause many years ago. And I always say, like, I would never, ever change my story and what I did because I wouldn't have the 5 kids that I did. But now that I know there's this restorative reproductive medicine and fertility awareness-based methods and getting to the root cause of things, like I just feel like it is my purpose and mission now for the second half of my career to move in that direction and educate my patients and then my own 2 daughters of how to cycle track and body literacy and all the things. So I really just kind of, Dr. Duane always laughs because she's like, I swear, like you just came out of nowhere and then said yes to like every single thing. She's like, will you be a speaker for Facts? I'm like, absolutely. Because, you know, while it's in medical electives now, I'm like, I want these to be in nurse practitioner school. I want this to be in PA school. I want it to be everywhere because I think we're doing such a disservice to women by not educating the medical professionals. Because I don't blame, you know, the IVF doctors that I have. Maybe they just didn't know any different, but now that I know better, I'm like, I need to scream this on the rooftops to the world. So I did the cohort with Facts for neo-fertility, and then I did FEM, and I actually in the process of finishing my FEM teacher instruction, because even though I'm a medical professional and a nurse practitioner, I really wanted to see that side of it too, so that when patients come to me, I know exactly what they've been through with the teaching and working with the teachers. And then I also completed my FEM medical management course in June. I very recently got hired to a clinic in Seattle. So I'm working for 2 clinics, actually, just 1 day a week. But the clinic in Seattle, 3W, is now I'll be the second clinician that's medically management trained in FEM. The other one went to it with me, and we also have 2 FEM teachers. So I'm really, really excited because I get to use that part of my education, everything I feel like I've been working toward for the last year. So in the upcoming year, we'll really be able to treat patients that are dealing with hormone imbalance. And it's so many women suffer. And it just seems like everybody thinks that because symptoms are common, that it's normal, when it's not actually normal, right? And all the time you hear like painful periods, and girls are like, oh yeah, I do too. And I do too. And I just want to say to them, that's never normal. Actually, it shouldn't be so painful that you're missing school or you're missing work. And also a huge part of my story is that, so I played college soccer. And then I trained for a couple marathons afterwards. And when we decided we wanted to start having children, my doctor was like, well, you work out a lot. And the story, like when I lost my period when I was playing college soccer, and everybody was like, oh, that's really common in collegiate athletes. That's super common. And now I am like, girls, it is never, never normal to stop your period. If your period stops, you need to get it checked out. And yet back then, and even still now, I feel like people are still saying that, and like it's normal and it's okay, and it's not okay, because it just means there's most likely this energy deficit, right? So kind of lost my train of thought, but I lost it when I was playing college soccer. So then when we did want to start having kids, she's like, let's give it a break, from like training, and see if that brings your cycle back. And they kind of tried to do like the Provera challenge, and still didn't have a bleed. And so I kind of went straight to IVF, which in a way I felt like lucky, because I didn't have to spend, a year or 2 years just trying and then not getting pregnant. Because so often, right, that's the other thing, is that there's these hormonal imbalances. Now I know, I'm like, if you see like 2 or 3 cycles that are not normal, if you're tracking them, you can start right away and address that as an infertility issue. Whereas so often it's like, you need to try for a full year before we'll like even consider digging deeper into this. And just along the way, like I was seen by a reproductive endocrinologist when I was going to nursing school in Rochester, New York. And again, he's like, yeah, I mean, your labs aren't quite normal, but you're not trying to get pregnant, so it doesn't really matter. Offers me birth control, and this will help regulate your cycle. And then when you want to get pregnant, then you can kind of figure it out. And of course, years go by, and then when I do want to get pregnant, it's not happening. And it's all these years lost of that the issues could have been addressed. And I even remember, because I had a diagnosis, which is better than some. I feel like so many people that go through infertility get the infamous unexplained infertility, which has just got to be the most frustrating thing in the whole world. And now all the studies that show the people that then go on to do reproductive restorative medicine end up getting a diagnosis and getting treatment and then getting pregnant, lo and behold. But I did have the diagnosis of, they said at the time, hypogonadotrophic hypogonadism, which is sure a mouthful. And so I went to her because I was a nurse practitioner, right? So I'm like reading all the things, and I'm like, am I exercising too much? Am I eating enough? Like, if I stopped exercising completely and gained 20 pounds, like, would that make a difference? And she said to me, no, it wouldn't. And I was telling Dr. Dwayne this actually, and she goes, I think she probably said that because in her eyes, it didn't make a difference in your IVF path, right? Like, they had this path set out for me, and I was still going to get there regardless of if I stopped exercising or gaining weight. But had I done that, then maybe it would have restored my hormones at the time. So anyway, do you want me to share about like my IVF journey then?
Yeah,
Or
yeah. So
okay.
it's interesting. You and I share a little bit in common. So I was diagnosed with hypothalamic amenorrhea. So it's
Mm-hmm.
similar, moving too much and not eating enough for the movement.
Mm-hmm.
And gosh, it was yeah, really hard. We just conceived kind of the old-fashioned way because I finally, by God's grace, like had the willingness to cut back and rest more and eat more. And yeah, my body knew what to do. Thought it was all the things. Oh gosh, maybe I have a cyst or maybe I have a growth on my pituitary. Maybe I have this. Maybe it's something extreme. It's like, nope, you just are moving too much and not fueling enough. And it's like,
Yeah.
gosh, it's really that simple. And yeah, and now, yeah, we're pregnant. I'm so grateful. Um, and it wasn't, you have to, I think women, I don't know, I don't want to, I'm not speaking for you. I'm just saying the women that I've interacted with that have had HA, it's, this fear of letting go of those routines and that lifestyle for any length of time is just, oh my gosh, I'm going to, lose all this athletic ability I have. I'm going to lose all this. Man, I would never have said I was low energy or I never. I mean, I'm super high energy. Like I have all this energy. I'm never tired. But man, when I started fueling just a little bit better and resting a little bit more, I just had so much more energy. I was happier. Like these hormones make a huge difference. When you have good estrogen and progesterone in your cycle, especially in like the case of, low energy availability, you don't have high estrogen. And that, gosh, it impacts everything. Like yeah, anyway, so I was
Yeah.
blown away by the power of making those shifts
Right.
for fertility health, for cycle health. And it's interesting too, when you're talking about your experiences with different medical professionals, uh and we just talked about this again with another interviewee on the podcast, is how interesting it is that so many medical professionals don't know that, ovulation is a sign of health and not ovulating is not a good thing. And we need to be ovulating. So I have to
Right.
tell patients like, oh, you're fine. Like, sure, you're not ovulating. Your hormones aren't that off, but you don't want to get pregnant. So it doesn't matter anyway. It's like, no, like we should be doing this regardless of our pregnancy goals. Women should ovulate every month, no matter whether you're trying to get pregnant or not. Like it's just, you
Yes.
need the hormones. You need the hormones that are being produced by doing that.
Right.
So yeah. So I say all that. And I would love to kind of backtrack a little bit. I'd like to hear how you're using it in your practice now too. And oh my gosh, Shannon, talk about jumping in with 2 feet. Like 2 feet, two arms, whole head. I mean, you have just like, I didn't know it's only been a year since you've been even introduced to all this information. So yeah, you're really drinking from a fire hose
Yeah.
very
Yes.
well to have all of these certifications already under your belt. That's amazing.
Oh, thank you.
Yeah, it's very
I just
impressive.
kind of like you had said before we actually started, when I found out about this, it was like this fire was lit under me. And I think because of my personal experience where I was like, oh my gosh, like my journey could have been so much different. And like I said, I would not change it because I wouldn't have the 5 children that I do. But I don't wish the IVF path for anybody.
Mhm.
It not that infertility and then going through restorative reproductive medicine is easy because that's a journey too. You have to get to the root cause. You have to make some changes, like you did. And I actually like currently am in a phase of trying to restore my hormones now because it was years until all of a sudden, like you, I was like, oh my gosh. And it wasn't intentional under fueling. I was like, I'm consuming 2,000 calories a day. Like that's a lot for a lot of women, which is probably not good that a lot of women are not consuming that much, but for the amount that I was moving. So I'm still like on my journey to restore my hormones. And it was just like, because I was educating myself for my practice and my profession of like listening to all these podcasts, and then it was like the HA ones kept popping up and I was like, oh my gosh, like my cortisol levels are high, my thyroid is shot. And again, I think going through all the fem training and learning about this and the cycles and the bodies, and it literally, if your hormones from your ovaries are not working well, or your pituitary gland is shut off, hypothalamus, that access, it impacts everything. And I think that's what people just really don't realize. And why I feel so strongly that even like starting at age like 9 and 10 of just knowing their bodies and knowing what a cycle should look like and what a normal cycle is and all the parameters of a normal cycle and get them charting so that then girls can advocate for themselves and know like, okay, this isn't normal. I need to go to my doctor and have that education and ability to then, if they're not supported by that specific healthcare professional, to go to someone else and find someone else that will support it. Or even like, I just think how proud I would be as a mom if, my daughter is cycle charting and knows what's normal, and a friend is like, oh my gosh, my cramps are terrible, I miss school, and she's like, that's not normal, like how awesome would that be if then it's just this little ripple effect, right? So I
That's
just
huge.
feel so strongly that it's my job now to educate women just across the lifespan. And I'm like, there is so many people that even in my teacher training, I've, done a handful of practice clients basically. And where they're like, oh my gosh, I never knew any of this. And me too. And I am a nurse practitioner, and that is just like ludicrous, really. It just is such a disservice to all of us that we don't have this knowledge. So I'm just really excited that I at least found it now. I'm secretly a little bit jealous of all the like, the students in medical school that get it like right in school. I'm like, you guys are so awesome for doing this. Like, I'm so proud of them. But also just wish that I would have even known about it sooner. But now that I know, I can just do the best I can as I move forward for the rest of my career. So
Absolutely. And I would say you've already made up a lot of ground in just 1 year. So that's really amazing. It's just so amazing.
thank you.
Yeah, so let's go back a little bit, I guess, to when you and your husband got married and decided, okay, we'd like to try now to have children. How did, your experience of not being able to conceive lead you to infertility and then, infertility, a diagnosis of infertility, and then in vitro fertilization as your solution to try to achieve pregnancy?
Yeah. So as I mentioned, I played college soccer, finished that. And actually, I qualified for the Boston Marathon and was training for the Boston Marathon. It was actually the year of the bombing that I ran it. Yeah, it was insane. But like by the grace of God, I was through the finish line. My family had met up with me, but we were about 2 blocks away when we heard it go off. So anyway, I finished marathon training, and then that's when my doctor was like, okay, now that you're done with this, like, let's give it a couple months, see if your cycle comes back, and we'll go from there.
And I'm sorry to interrupt you, Shannon. You weren't on any birth control or anything, right?
Not at this time, no.
Okay.
But I had been like in nursing school when I had seen that reproductive endocrinologist. He had put me on it, and again, it wasn't for birth control.
Right.
It was to quote unquote normalize my cycle, which again, now I'm just like, oh my goodness, it
Doesn't
is the
do that.
Band-Aid for everything.
Yeah.
Yes.
The pill does not do that. Yeah.
No.
Okay. So it was basically you were in a state of, kind of energy imbalance, which is what was suppressing ovulation, most likely at the time.
Yes.
Okay.
Yeah.
Gotcha.
Yeah.
So
Looking back, that's what I'm like, that probably was it.
Okay. So you finished the marathon and decided to try to achieve.
Yep. And when
Congratulations, by the way. That's a great accomplishment.
Oh,
to run the Boston Marathon.
I haven't run one since, but that's
okay.
So very quickly, they were just like, we're going to refer you to an infertility clinic. And, at that time, and even now in the greater Seattle area, like there's not restorative reproductive medicine. And so there was never even like, let's look at the root cause or anything like that. I just went straight to my infertility clinic. We did 2 IUIs, or what used to be called artificial insemination for anybody who doesn't know that, that were unsuccessful. And then it really was just like, if you want to become pregnant, IVF is your only way. And that was the way it is.
Now, sorry, Shannon, I don't mean to interrupt you, but just because I think since we're both interested in this, is like, it's always fun to kind of nerd out on stuff like that. Do you think now, like looking back and knowing what you know, is it like, well, of course IUI didn't work because I didn't ovulate. So you could pump as many sperm as you want up there. No one's going to attach because there's no egg there.
Right.
You know what I mean?
Yeah.
Like, I don't know. I think about that with my own journey sometimes. I'm like, that wasn't going to work.
Yeah.
Clearly you were not, medical professional, not to put all the blame on them, but it's like, did you not know, like, no investigation at all? Just like, well, let's just try this very
Right.
expensive intervention.
I
And it's
know.
like,
Yeah.
without thinking like, okay, we can put all the sperm we want, but does she have any
Right.
eggs to meet them? And then now that's when
Right.
they're just like, well, that didn't work. Let's go to IVF. And it's like, gosh, if you just paused for a second, even to just think
Right.
that.
Or even
Anyway,
like, I'm like, man, if only I had known about like cycle charting. And at that time, I obviously didn't have a period. But again,
right,
if I had just understood how the hormones work and everything that was going on, I probably would have like made a different path. And
right.
part of me feels so naive, but like,
Oh.
because I was a nurse practitioner, and you're
Mm,
like, maybe I
mm,
should have known this. But
yeah.
at the same time, it's like, especially when you're struggling with infertility, that you trust the people that are in that world
Yes.
all the time, because it
Hmm.
wasn't my world. Like, I studied family
Exactly.
practice at first, and then now I've ended up in women's health, and I'm so grateful for that, and now want to do all this restorative reproductive medicine. But
Mhm.
at the time, I didn't know it, and so you just
Right.
trust what they say, right? And
Absolutely. Yeah.
so desperate to, like, we'd always considered adoption as a possibility as well. My brother was adopted from Korea when he was 4 months old, and it was such a big blessing for our family. But and I was raised Catholic, although, like, I know a lot of Catholics are very much would never do IVF. That
And many
wasn't
will,
necessary.
because
What?
many don't know the teaching and many don't understand it. So, yeah.
Yeah.
Or you just
Um,
get overtaken with the I want a baby. And so I
right.
kind of don't want to know I kind of don't even want to investigate because I just really want to have a baby. And
Right.
that's our humanness, right? It's like when you're
Right.
in that mode of like, I want to be pregnant yesterday, it's kind of hard to slow down a little bit. And
Totally.
yeah,
And when, like, your whole life, it's like you're taught how to not get pregnant, right? Like, they place the fear in you, and it, like,
right,
seems like it's so easy to get pregnant. And where you hear
right,
those stories of, like, people are using condoms and on birth control and still get pregnant. And so, like,
right.
and then you're like, why on, like, they can literally, like, put it together for me and it still doesn't work.
Right, right.
Anyway,
Okay.
so
I'm sorry, I interrupted you. Okay, so you did 2 rounds of
so,
IUI.
mhm.
That didn't work, so
And
they said IVF was your only option.
yeah.
Okay.
So I just have
Now,
to
what was your
say,
husband doing at this time? Was he, just kind of like, whatever you want to do, sweetie, I'm here to support you?
yeah,
Or was
he was
he?
amazing. He was
Yeah.
amazing, like, every step of the way, because um the reason before I said, like, I don't wish the IVF path on anybody is because it was one of the hardest, like, darkest, most difficult things I've been
Mm,
through in my entire life. Like, just from a physical standpoint of, like, you're giving yourself injections in your stomach. Like, my stomach would be bruised, and sometimes there's, like, the specific timing of, like, the HCG trigger, and you're like, one time I did it in a restaurant bathroom because you had to do it like exactly 36 hours before, and it was so stressful. And then even once you were getting the medications, like, you were going in every other day at first, or then every single day, and I had to go all the way to Seattle, which was like, without traffic it maybe is 40 minutes, but with traffic it could be like an hour and a half. And so then you're missing work, and then the financial piece, of course, is like astronomical. And I feel so grateful, and so often I'd feel so almost guilty, like, that there's so many people that can't afford it, and like, it was this mixed emotions of, like, how blessed are we that we can afford this, but at the same time that other people can't. And that just seems so wrong in so many ways, that it really is like a socioeconomic thing.
mm,
um then emotionally it's just draining, of, like you said, like, you always had this vision of, like, I'm going to be a mom. And I just remember my sister one day saying, like, I wish I could give you a photograph of your family like 10 years from now, because it's going to look so different, Chan. And but at the time, you can't see that, and you have no idea. And we were so lucky that we had success, because so many people go through the journey and still are not successful. And to your point of, because if you don't restore certain things, like, some way there, it's just not going to happen.
mhm, mhm.
um
We had a
so
doctor on recently, and we were talking about restorative reproductive medicine versus different interventions. And I'm sorry, I'm not trying to like cut you off. I'm just
oh,
having
you're
like
totally fine.
conversation back and forth. And and I asked her a question because I've just been so curious about this. They talk about there isn't like a simple black and white answer. It's just like a thought I had, again, because of my own experience with fertility health issues, is that, women who do have success with IVF, it's like, I wonder, and my question to her was like, did they ever really need IVF anyway? Because I feel like IVF kind of insinuates like there's something your body can't do, and so we have to do it for you. But, again, like in my case, it's like, but I'm not ovulating. So you basically went in, my eggs are fine, my uterus is fine, I could have carried the baby fine, just the eggs weren't coming out. So you went and got the egg, and then you got the sperm, and you put them together, and you put it back in me, and I was able to carry them fine because I also had the hormones I needed that my body's not producing because I'm not ovulating. Like, not to make it sound so simple, but it did seem a little simple. Like, well, of course that would probably work likely for me because my body's in a somewhat of a healthy state, other than it's suppressed, specifically because of lack of nutrition and too much movement. So anyway, she did not have like a clear, like, answer that, well, yeah, they probably just had a simpler root cause that needed to be fixed, and then they could have achieved a pregnancy and had a live birth. And so IVF just lent itself to be likely more successful for them than someone who maybe had like terrible endometriosis that was completely ignored, and they kept trying to insert an embryo that would not keep because her body,
yeah.
Does that make sense, Shayna, what I'm trying to say?
Totally. Yeah.
Okay.
Yeah.
Anyway, just like a thought I had. But
Yeah.
so anyway, I appreciate you sharing, because I haven't heard this I know of women who have had IVF, but that's the extent that they have shared. It's like, yes, I had, and it's always like, I had to do IVF, and then that's it. It's like, well, what was that like? Because I haven't, like I imagine it's not fun, all the shots and the hormones and everything, but
right.
Yeah,
And I mean, because your body, like my body at least, was so low on hormones, then
right.
in some ways I felt better, but then in other ways, some people it's just like overboard, like you're just like, body doesn't know what to do with those hormones.
Right.
And then just the constant of like, is it going to work?
Is it going to work?
The next steps. And so I did 3 total IVF cycles, and it was on the first one, and then I think the second one, both of them, where I was taking the injections, and like a normal amount is like 8 days. That then they start like being able to go to the next step of like the egg retrieval. Well, my body just was kind of like a slow responder. And I remember them saying like, we might have to cancel, like your body's just not responding. And I was thinking, oh my gosh, like here I am, this like, I'm already feel abnormal because I have to do this IVF thing. And then you're telling me I'm more abnormal than like this abnormal population. And thankfully I just took longer. And so finally, and we got enough, they grew enough to then do the egg retrieval. And with my first and second, we got 3 embryos total. Our third IVF round, we had just 2. For our first round, we put in 2 embryos the first time, and neither took. And I remember exactly where I was sitting. It was in our old house. I was sitting on the couch, home by myself. My husband was at work, and the doctor called, and she's like, I'm so sorry, Shannon, it didn't work. And I was just sobbing. And like, at that point I was like, I am never going to be a mom. Like, and it was horrible. And, so there's just like so many facets, like financially, emotionally, mentally, physically, that it just is such you take such a beating, like on every single level, through this process. So we had 1 frozen left though. And that's it's a little bit easier of a process, I would say, because you don't have to have so many ultrasounds. But we were super lucky. My oldest daughter was our frozen embryo, and I think they graded her as like fair or something. And the 2 that didn't take were like great or whatever. So I always laugh because we're like, oh, our quote unquote fair little girl, she's the one who stuck and made me a mama. Yeah. And thankfully I was really lucky that I was able to breastfeed all 5 of my kids, actually, because they say that infertility can be a risk factor for not being able to breastfeed. But we, and again, like then when we wanted more children, there was a never like, let's go back and look at your diagnosis. Let's try to get, it just was like, okay, IVF again. And now looking back, like maybe in between we could have done something and changed something. I wouldn't want to, because again, I don't know if I would have had the same 5 kids that I did. But so our second one, we transferred 2 in. We lost one
So
of them.
can I ask,
Oh.
sorry, Shane, can I ask a question? When you say a round of IVF, what does that mean?
So an actual like egg retrieval.
Oh, okay. That would be considered a round.
Yeah.
Okay, gotcha.
And a lot of times, so the first time they wanted you, like, I had to not be breastfeeding anymore because they want to be able to manipulate all your hormones, right? So
Right.
a lot of times they'll put you on some medications to just suppress everything for like the month prior. Then you get the injections. And again, it was sometimes twice a day and always like in your low abdomen, mine, or you could do like the back of your arm. I always did my abdomen. And then the egg retrieval. We never did genetic testing. We always did fresh transfers if we were able. And it's so interesting because
What does that
infertility,
mean? What's a fresh transfer?
like, so the embryos, they grow the embryos. It's such an amazing process, like all the things. So when they do the egg retrieval, obviously they try to fertilize with my husband's sperm. And then the next day they'll tell you how many actually fertilized. And then usually they'll give you like a day 3 report of how many embryos are still growing. And then day 5 is when you go in, and they really want, like, in order to have the best success at getting pregnant, like the day 5 embryos are the only ones that they'll transfer, at least in the clinic I went to, because of that's at the point they get to blastocyst. So then you go in that day not knowing, like, if you only had 3 left, you could maybe have 1 or 0. Like, you could go in and they could be like, I'm so sorry, none of them made it. But we were really lucky that we did have 3 that first time. But when I say round, it's just because then we had no more embryos. And so then we had to go back through the whole process again with injections and then the egg retrieval. So the second IVF cycle, we again got 3 embryos. And we transferred 2 fresh. So it was like the day 5 we went in. There was 2, they picked the 2 like best looking ones based on their grading system. The embryologist does that and comes and talks to. We lost one of the embryos, but then the other one made it, and that's my oldest son, so our second kiddo. We froze the 3rd one. Again, the freezing, so you pay like a monthly fee to keep the embryo frozen each month. And then it was about 10 months after that, because we always wanted to start kind of a year after we had one, just knowing that it could happen right away, or it could be like 2 years or 3 years, because we didn't know if we'd continue to have success with it. But our 3rd child was that frozen embryo that was the 3rd of that second cycle. And then my husband and I had always said we wanted 3 or 4 kids. I had 3 siblings. He had 2. So we decided to go for a 4th. So we did a 3rd IVF cycle, ended up with just 2 embryos, and we transferred both of them. And we have boy-girl twins who are just so delightful and fun. So that's how we became a family of 7.
Wow, that's amazing. So you don't have
Yeah.
there's no babies that are frozen.
No. And I'm
Gotcha.
so grateful for that,
Right.
because again, I talked about all the physical, emotional, mental, financial aspects. And then there's the moral and ethical issues that come into play with religion. And I mean, it's hard sometimes because I'll hear podcasts where they equate IVF to abortion. And that's really hard as someone who's been through the IVF process to think of it that way. But there's a lot of different facets to it too, where when they have those arguments, a lot of the time it is when people have like 20 embryos left and they're just frozen right now, or even the whole, like, kind of people pick and choose the genetics, and you do the genetic testing, or some people like specifically choose a girl embryo. I know there's a lot of moral debate about that. But I was really thankful that we didn't have any left, because I just think it's a really, really hard issue
Right.
that until anyone's in that position, you don't know what you would do, right? So
For sure. Yeah.
we were able to successfully transfer all of them.
Give
We lost.
everybody an opportunity.
Yeah.
Right.
Yeah.
Right. Yeah. I imagine that would, yeah. If after going through that process, kind of like, being on the other side, reflecting back, like, yeah, I could see how that would be kind of a grateful aspect of it of like, oh my gosh, I'm just so glad I don't have babies that are frozen that I'm having to think about what to do now, like
Right.
that. Yeah, that would be a really, really hard place to be. So,
Yeah.
anyway, thank you for sharing all that. So how old are all of your kids right now?
So my oldest is 10.
Okay.
Our second oldest just turned 9.
Okay.
And then we have a 7-year-old, and our twins are 5.5.
Oh, fun. Oh, those are really fun
Yeah.
ages. Oh, that's
Yeah.
awesome. Very good. Very good. Okay, so I guess kind of coming to now, or maybe we can just move forward. So you have your kids. Are you working the whole time? Are you home at
Um,
all?
yeah, I mean, I took like my first one, I think I was only off for like 3 months of maternity leave. I started out in family practice
Okay.
and then worked in like a surgical pre-anesthesia clinic. I
Right.
was there for about 10 years. And then we had our twins in November of 2019.
Okay.
And so I was supposed to go back in June of 2020, but then they pulled me back early because someone else went on maternity leave, but it was March of 2020. And our hospital actually had the very first COVID case, like in the US, diagnosed. Yeah. And so because we were a pre-surgery clinic and a lot of them were elective, they're like, you can stay out the full, 6 months with your twins. But then because of COVID and changing schedules and everything, I was like, I'm just gonna be home with my kids. And I was for a few years, and then worked as a school nurse for a couple years. But it wasn't working towards my nurse practitioner license. And so that was then just this last year where I got hired into the clinic here in Everett, and then just recently got hired to the clinic in Seattle.
Okay. Oh, that's great. I do want to just so listeners don't think like we've kind of glossed over it. I just want to spend like 2 seconds here talking about the abortion comment that you made and how sometimes that can be a harsh thing to hear for someone who's maybe gone through using IVF. I guess it's important to know like what is the similarity there, and I think there could be similarities in a couple different levels. And one is just like the understanding that a human being starts existence when sperm and egg unite, and so that's a genetically unique individual. And
Mm-hmm.
then if baby doesn't attach to the uterine wall, then baby passes away at a very early stage in human development. And that happens with women who miscarry. That can happen without you even kind of knowing it because you could get
Mm-hmm.
pregnant, baby goes through the fallopian tube and just doesn't implant for whatever reason. And you may not even get a positive pregnancy test, right? So that can happen for a lot of different things, a lot of different reasons, I should say. And so that's one of the reasons why we say, certain methods of birth control are abortifacient because of their underlying mechanisms of action that while trying to prevent ovulation, maybe not always successful, but then their backup mechanism is to prevent implantation. So then baby doesn't attach. Okay,
Mm-hmm.
so that same thing might happen, right? When doctor inserts babies into uterus and one or more don't attach, then the baby passes away. The thing that, I think you and I were just talking about though is like it's wonderful though when those babies are given the opportunity to attach
Mm-hmm.
as far as like moral, ethical, like kind of ladder of goodness, that's like pretty great, as opposed to
Mm-hmm.
just a different approach or mindset would be like, let's get as many babies made as possible. So we've got like 20 here. And I just want to do two. And we'll just put the rest on ice and maybe get back to them another time because like I have the family I want now.
Mm-hmm.
That's like a completely different mindset and like has a lot more flags raised, about kind of ethics, morals, how do we view human life and what's the meaning of marriage and family and all of those things. So I just want to, I say all that because it seems like it could be very black and white. But I think kind of really hearing people's stories, understanding intention, understanding prior knowledge, it doesn't change the reality of like just science and human biology, but it very much can impact, one's culpability, if you will, because that's really important too. I think when we're talking about feelings of, guilt and remorse or shame, intentionality has a lot to do with those things too. So anyway, I just wanted to touch on that a little bit.
Yeah. Thank you. Yeah.
Yeah, it's important. So, okay, so you start going back to work, stop being a school nurse, and you go back into practice now with this center. And you had since you started at the center, were you not doing fertility awareness since that's just been within the last year?
Correct. So
Okay.
I got on that webinar and first heard of it probably in like May or June.
Okay.
But my first day of actual work was July 22nd of 2024. I just had my like 1 year anniversary with the clinic, but
Oh, great.
yeah, and I just did the medical management course for FEM this June.
Okay. Oh,
So
wow,
it's
like a month ago. Oh my gosh,
yes.
that's great. Yeah.
Yeah. So very, very new.
Okay. And so have you been able to, over the past month, like use it in your practice? I know you had to do kind of a practicum with them, right? As like a student.
The teacher course.
Yeah.
So I'm not actually officially certified as a teacher yet because
Okay.
you take 10 weeks of courses, but then you have to have a minimum of 3 practice clients.
Okay.
And you do the 3 teaching lessons with them, but then they each have to cycle 3 full cycles.
Okay.
So it started in April. So now we're just at the point where they have to finish charting their 3 full cycles. And then I did a write up on like each of the sessions I taught for one of the clients. And then you evaluate their cycles and then take the test. But as far as the medical management piece, once you've gone through the course, you're considered a FEM medical clinician and can start practicing in that way. In my clinic up here in Everett, we're not yet incorporating that. We're actually just launching our Well Women program at the end of August, which is awesome.
Oh, that's great.
I was kind of hired to the clinic because that was always their vision of wanting to grow it, because it had been previously for like urine pregnancy tests and ultrasounds for dating, and offering resources and support and some STI, sexually transmitted infection, but limited scope like gonorrhea, chlamydia, and trichomonas only. But now we're going to be able to offer a lot more services. So that launches in August. And then my clinic in Seattle, they already had in place Well Women program. They're just adding for this August sports physicals. And I'm really excited about that because, again, it's those young girls we're seeing, and being able to teach girls about their bodies and body literacy and how to chart their cycles for the purpose of health. Because you hit the nail on the head earlier when you were talking about ovulation is a sign of health. And I think so many women don't actually know that, and know that if you're not ovulating, it means there's a hormone imbalance. And it's not just estrogen and progesterone. It's that the switch in your brain could be turned off and FSH isn't going and LH isn't going to go. And then your thyroid's going to go to like down in the tank, and all these things that are a part of that. So I'm just really excited to be able to implement it and just teach women across the spectrum, because it doesn't have to be for the purpose of wanting to get pregnant. It can be to avoid pregnancy and not have to use birth control, because again, that's another thing that growing up, we are not given informed consent most of the time when it comes to birth control and all of the negative side effects. And the biggest thing for me, I mean, there's so many side effects that like we can go on and on about that, but it's the mental health component. And this one, I'm sure you've heard of the Danish study of like 1 million women. And going into the study, none of them had diagnoses of depression or anxiety. Nobody was on antidepressants. And then they went on birth control, and the women were 1.5 to 2 times more likely to have been prescribed an antidepressant because of being on birth control. And then in the adolescents, they were even higher than the older women. And that to me is just like, it's incredible and horrible. And so in learning
and makes a lot of sense at the same time, because we know, it's not like we don't know how good estrogen, specifically estrogen and progesterone, the two dominant female hormones, right, are for our mental health, for our
Right.
brain, for our hearts, for our bones. I mean,
Yes.
yeah, that was, I think that it's so funny because, again, just like my personal story, it was just, or my personal experience was just knowing like, wow, when I started to treat my body the way it needed to be treated, fueling and resting well, and my estrogen rose, I was happier, which I wouldn't have thought I wasn't happy before, but I was just so much happier and so much more present and like if you had said I had any mental health anything, I would have probably said no, and I don't think I would have qualified for anything, but just kind of like a grouchy, grumpy, which I was hungrier, so that could have been why too. But just to know, like, man, yeah, when your hormones are off, you don't feel good. Ask any woman postpartum, right? It's such a wonky time. So
Yes.
what makes us think then, like in all the natural ways that like women don't feel good when their hormones are off? Pregnancy, postpartum, nursing, not having your period, like your
Yeah.
period's just starting, right? Puberty, you're going through those shifts. Girls are just feel like they're crazy. Yeah, why don't we think like, oh yeah, we're going to put them on these synthetic hormones, mess up their cycles, and then they start to feel crazy. That's like a shocker. It's like, but
Right.
not really, because it happens naturally when their hormones go off at different seasons of life. So anyway,
Yeah.
it's just so funny, and I understand the need for research, and I'm all for evidence-based practices. It's just
Yes.
so funny when we find something out, it's like, and we're like, well, duh, like, do we really need to do all of the, spend all that money and do all that research to know, like, well, of course, you mess with this is what's going to happen. So,
Right. Right.
anyway,
Yeah.
yeah, the mental health part is, yeah, it's
Yeah.
definitely one of the big things I think to talk about when they're considering their options for family planning or just for health, right? Trying to find, relief from different symptoms for painful periods, etc.
Yes.
We recognize that the birth control pill can help suppress those symptoms sometimes, but it is very much, as we've already mentioned, like a band-aid solution. And so
Yes.
trying
And
to
there's
push,
also so many other ways to
yes,
help those symptoms
right.
without suppressing it. And then I just think of like all the years lost of feeling well. They call estrogen the happy hormone. And if you just put that band aid on it, then you lose years of your health, really.
Right. Yeah, it'd be
So,
so cool to Shannon see how you're going to be used moving forward. It'd be really neat if you could tap into the young athlete population because that is just you're right. It is so just accepted that young female athletes, collegiate athletes, high school athletes, like, oh, you just lose your period. Like that's just normal. And then when you're done with your sport, it'll come back. It's like, no, it's not normal. And you're actually probably not performing at peak performance because you're not having
right.
estrogen. Like
Right.
estrogen is going to help you be stronger, more mentally with it. Like you will perform better if you have your hormones.
Right.
Have you heard of Dr. Stacy Sims?
I don't think so.
Oh, I have to send you her information from Stanford. Anyone that's listening that's a female athlete or likes being, likes to move their body more intensely, whatever. She's so awesome. She's so awesome, Shannon. Oh, you're going to love her. She's done so much research about, her tagline is women are not small men.
Oh, yeah.
And she's all about ovulation, maintaining cycles, and performing great at your sport. Like you don't have to trade it out. And she just focuses a lot on studying women and the impact of their hormonal shifts throughout their training period. She works with a lot of like professional triathletes and endurance sports. And anyway, it's
Oh,
so interesting. So
that's awesome.
yeah, so even if you're a woman and you want to do a sport, you're a young girl, like you can do that. We just want to keep you ovulating and you want to keep ovulating if you're an athlete. Like it's going to help
Right.
you in your performance too. So just Shannon, I want to bring you back on in like 5 years. And be like, where's Shannon now? Since you've already
I
done
would
so
be
much.
happy to.
Yeah, in the first year, it sounds like just so much good stuff. And you have got such a beautiful story to share, like I just want things better for the next generation, which I
Yes.
think is just a wonderful motivation to have in order to go out and help people. So, yeah, that's just excellent. Is there anything you'd like to kind of wrap up with or comments you'd like to leave our listeners with, insights or final thoughts?
I don't think so. The only thing I would say is if you're not cycle charting, find a method that works for you and do it because I think that's the biggest thing of like, I'm 40 now and I'm like, I want this to be my healthiest decade yet. And it can be for you. And if you're having any sort of period issues or painful, like horrible painful periods or symptoms, it's probably tied to your hormones, and so much can be gleaned just by tracking your cycles and using your biomarkers to figure out what's going on, and whether or not you're ovulating. Because again, that is the fifth vital sign, as they say, and just
Right.
such an important indicator for your overall health and longevity, really.
Right, for sure. Yeah, that's so great. Yeah, we'll link to facts about fertility since we've talked about them a lot. Maybe you could also send me the links to the practices you're talking about that you're going to be working with in that Seattle, Everett area. So in case
Hmm.
anyone that listens is in that area and is looking for some help, I predict you're going to be extremely busy,
I hope
as most people
so.
are. Yeah. As most physicians and medical professionals that I've met that get into this world, it's like, oh my God, they don't regret getting into it, but it's like, oh my gosh, I thought I was going to lose patients. I am like busier than I've ever been. Because I think we do see kind of a groundswell of, women kind of demanding better. Like,
Hmm.
no, I don't want the pill. Like, I'd like to just, that's not going to actually make me bleed. Oh, sorry. The other thing, Shannon, I wanted to just kind of, I guess, shed light on is, you shared your 40 and this was brand new information to you. And so many women still say that's brand new information to me. I think it really speaks volumes, or I find it interesting that like we live in such a information saturated world right now, right, with the internet, and yet still so many women don't know this. And I think that
Right.
it really does speak to kind of the power of, you know, your personal relationship with your physician. And if your
Hmm.
physician doesn't know how much we really do trust our physician. And so, depending on what they say and what their knowledge base is, can really inform how we go about finding, treatments and seeking out options for whatever situation we may be going through. Because I feel like a quick Google search now with, symptoms, so much could pop up, but it's finding like that source that you can really trust, which makes sense, right? You don't just always want to just trust Google and what they say
Yeah.
or the latest influencer. But yeah, I
Yeah.
do find it interesting a little bit. Like, wow, so many of us still, yeah, we still don't know
Right.
the amazingness of like our body and what it's designed to do and how it can do those things. So
Right. It is so perfectly made. It's
it
unbelievable,
is.
really,
Yeah.
how it works.
Yeah. And I loved your point too. I think it's so powerful for moms to know about this because then they can teach their daughters. And to your point, then their daughter could be in school and someone says something and they're like, well, that's not normal. And they'll say, what? That's not normal. And then you start to change the culture of like,
Right.
yeah, what's normal? It's not normal to be bent over in pain. It's not normal to, have these crazy PMS waves, and
Right.
a period should be kind of a non-event if it's
Right.
healthy. It kind of should come and go pretty quietly. So yeah, it's really exciting that that now, yeah, I just see all these ways, Shannon, that you can just, yeah, impact your family and then trickle it out in your practice too. So, well, we'll be praying for you. Thank you so
Thank
much for
you.
your
Means a lot.
time.
Thank you. Thank you
Yeah.
so much
And
for asking me on it.
oh
I
yeah.
feel honored.
Yeah, we will have to touch base in like 5 years.
Sounds
So we
good.
can see what are you up to now. So good luck with everything. You're doing amazing work. We really, yeah, can't have enough trained medical professionals that are knowledgeable about alternatives and sharing that with our patient population. So thank you, Shannon.
Thank you.
That wraps up another episode of the NFP Podcast. Thank you so much for joining us today. We hope you found our discussion enlightening and empowering. Don't forget to subscribe so you never miss an episode. We'd love to hear from you. Please connect with us by sending us an email with your questions and stories to thenfpshow@gmail.com. We'll be back next week with more insights, tips, and heartfelt conversations about natural family planning. Until then, love responsibly.